about NIMA and NIMA Women's Forums activities conducted by it, and also who wants to become a NIMA member can avail benefits of the NIMA organizations. To join NIMA, the following criteria are to be fulfilled. Every ISM graduate can become a NIMA member. MBBS and BHMS graduates can also become our co-members, but they can't be the part of our post of any post or committee member of NIMA. We need a photograph, MCIM registration photo, degree certificate, and membership fee for lifetime membership of NIMA. After becoming NIMA member, if you want to be the part of NIMA Women's Forum, then minimum 11 females NIMA members should come together and form a NIMA Women's Forum branch with the permission of NIMA local body. For any queries, you can call us. Now, I request Dr. Shilpa Korani ma'am and its technical team, Dhule team, to play Dhanvantari Stavan. Shilpa ma'am?
Yes, one minute.
स्तवन नमामि धन्वन्तरि
सानिका पॉज झालाय.
पद्मं लो
सानिका मॅम आवाज येत नाहीये.
सानिका पॉज झालाय.
सानिका लेफ्ट झाली आहे. शिल्पा प्लीज प्ले कर.
धन्वन्तरि स्तवन नमामि धन्वन्तरिमादिदेव सुरासुरै वन्दितपादपद्मम् लोके जरा दाता रमीशं विविधौषधीनां शङ्खं चक्रं जलौका दधदमुखघटं चारुदौर्भिस्ततुल्यं सूक्ष्मस्वच्छादिरुद्यम् अन्तपरिविलसन् मौलिमं भोजनितं कालाम्बोदज्वलाङ्गं कटितटविल सच्चापिपराढ्यं वन्दे धन्वन्तरिं त्वं निखिलगदवन प्रौढदावाग्निली
Thanks, Shilpa ma'am and team. Our today's chairperson is Dr. Amrita Mishra, Associate Professor, PTSR Department. She has done her MBBS Gold Medalist from Vidarbha Ayurved Mahavidyalaya, Amravati, MBA in Clinical Research and Healthcare Management. She is awarded Jivaka Vishwa Samman for Best Paper Presentation at Jivaka International Conference at Bangkok, Thailand in February 2006. She has teaching experience of 15 years and has more than 15 publications. She also has presented more than 30 research papers. Our today's co-chairperson is Dr. Madhavi Jaware, practicing since 18 years in Buldhana. She is president of NIMA Women's Forum Buldhana branch. She has done her MBBS in Poddar Medical College. She has almost done 10,000 deliveries in rural areas at Motala and Buldhana. I request Dr. Madhavi ma'am to conduct further session. Over to you, ma'am.
Thank you. Thanks, Dr. Smita. Thank you very much. First of all, pay my namaskar to all dignitaries overhead and all NIMA friends. We have to rush because there is very limited time and subject is too vast to cover. It's my immense pleasure to introduce our today's speaker, Dr. Pushkala Badrinarayan. Dr. Pushkala Badrinarayan is highly experienced Ayurveda practitioner. She has a remarkable career that includes being awarded the Dr. Srinivas Murthy Foundation Scholarship, Best Outgoing Student Award, and Gold Medalist in BMS from Sri Jayendram Saraswati Ayurveda College, Chennai. She pursued her post-graduation in Ayurvedic Gynecology MS from Dr. B.R. Care Government Ayurvedic College, Hyderabad, where she completed her thesis on PCOS. In December 2020, Dr. Pushkala established Amrita Ayurveda, a pharmaceutical company that specializes in providing high quality and fast-acting unique Ayurvedic formulation to the world. Dr. Pushkala Madam has held the position of professor and head of the Department of PG Studies in Prasuti Tantra and Shri Roga at SDN Institute of Ayurveda and Hospital, Bangalore. Madam's remarkable achievements and contributions in the education and business sectors, making her an inspiring figure for the next generation. We are delighted to have such a strong and a very knowledgeable speaker, Dr. Pushkala Badrinarayan. Today's topic is infertility concerned to PCOD and obesity. Before starting the lecture, I would like to request you all, please mute yourself. And whatever your questions, put or post in chat box. Your queries will be solved by our respected speaker after lecture. Thank you. Dear Dr. Pushkala Madam, you can start your lecture now, please.
Thank you. Thank you very much, ma'am. I thank NIMA and I thank Dr. Pragya ma'am to, get me into this group. And this is a wonderful opportunity. I have been listening to all the speakers, wonderful speakers. And, I'm so happy that I am also a part of this, session to talk on infertility. Infertility has always been and is my favorite topic, because for almost 16 years I have been practicing, and all these years, this infertility as well as PCOS, which is my thesis topic itself. So this holds a special place. So I treat only gynec disorders, others I refer. So once we get a infertility case, I think all our practitioners, you all can understand, we become, a part of them. We become that gives a emotional connect. And that gives the ultimate satisfaction when the patient tells she's pregnant. So with this, with the topic that I have literally fought to take in my PG as thesis. So I'm here again to talk on PCOS. Doctor, you will be sharing the screen, or I should share the screen?
No, ma'am, you should.
Okay.
Yes.
Everybody is able to see, right?
Yes, ma'am.
Thank you. So we are seeing PCOS. I have not mentioned obesity separately because in PCOS especially, we see most of the cases as obese as well as lean PCOS too. And nowadays it is becoming more and more stubborn PCOS we are getting. So I did not include obesity as a separate topic. I have included in PCOS itself. So as we all know, especially as Ayurvedic doctors, the blessing of Lord Dhanvantari is very much important to give any result to the patient. So with that, though the Dhanvantari Stavam has been done, I want to invoke Dhanvantari again. Namami Dhanvantarim Adidevam Surasurair Vandita Pada Padmam Loke Janarubhayam Mrittinasham Dhataram Isham Vividoshatinam. Why PCOS? There are lots of other cases. There are more painful conditions like endometriosis. Why PCOS? Like it's been there. Do you know how many research papers have been published on PCOS? Back in 2006, when I was taking PCOS as my thesis topic. My thesis was clinical effect of Saubhagya Shuddhi Dvitiya on Pradushtartava with special reference to PCOS. So when I was taking this topic, I was advised not to take it because my co-guide, ma'am, felt that I would not be able to complete 30 cases because we were getting so less cases in 2006. But I was very much interested because my cousin already was suffering with PCOS. I was seeing few people around me having PCOS, and it was looking a little bit challenging that during those times. So literally, I had to request ma'am. I have to somehow make my way to get the PCOS as my thesis topic. Though I completed 40 plus cases in that. Now when I look back, it is such a surprise that nowadays to get a normal scanning, it is difficult. So in 2006, when I was doing my PG, we got good number of cases, but it's not as prevalent as what it is now. What we are seeing now has crossed many reasons. Now, in those days, maybe lifestyle was a reason, food was a reason, but nowadays it has crossed that. It is already becoming something into a genetic disorder, right? So if the mother has PCOS or if the mother has very high AMH, again, which is also a part of PCOS, it is said that the offspring is also born with high amount of chances that she gets into PCOS. This is also being proven. So where are we heading into? That's a very big question mark. So whatever research has been done, so much of scope is still available to do in PCOS because every year, every decade, I think it is changing its position from a lifestyle disorder, from a metabolic disorder, from a disease to a syndrome to now a genetic predisposing disorder. Lots of changes and lots of tremendous changes has been happening in PCOS. And as such, when the disease is so prevalent, we will understand that the research is also pretty prevalent. From 2012 to 2021, we have got 10,064 research publications. This is inclusive of non-English publications also. 10,000 research publications in 10 years. So almost 1,000 per year research publications have been happening. I'm talking only about publications. Just imagine how much research have been done. Clinical research will be going on, maybe not published. So that is the amount of research also happening in PCOS. We know that in infertility, ovarian disorders are up to 25 to 45% of the cause in infertility, whereas PCOS is the major cause of anovulatory cycle, right? 70% of all anovulatory cycles are because of PCOS. Women with PCOS have a higher risk of increased miscarriage, right? So all these we see that there is a huge deficit of the disease growth as well as prevalence versus the public need for the PCOS. So I'm not going into PCOS definition and all because we all know that we all are practitioners and Rotterdam's criteria we know. So I'm not going into details of that. I just wanted to focus on Ayurvedic point of view. So we all know factors responsible for conception. Dhruvam Chaturnan Sanidhyat. So all these Rutu Kshetra Ambubija will come. Along with that, Saumanasyam Garbhakaranam Sreshtam. So Saumanasyam is important and Apanavata plays a very important role. So even that becomes a integral part of a factor which is responsible for conception. And in PCOS, we see that every single of these are affected. How is it affected? Coming to Rutu. What is Rutu? Rutustu Dvadash Nisha Drishtartma. There is a proper, fertile period. Now, in PCOS, we know that that is being affected. Rutu also is getting affected because of PCOS. There are many people who do ovulate. There are many people who have a regular, ovulation leading to a normal conception. Many also come to know that they have PCOS after delivery too. So that is nowadays it is becoming very, very small category of people. Now the majority of the people what we see have an ovulation that too to an extent of very strong ovulation. So whatever medicine that you are giving, many of us know, many doctors, we feel that whatever medicine we used to give few years back are not working. We have to fortify it nowadays. So many people, we used to give simple nasya, right? So even that was helping ovulation. Nowadays, that is not enough. So because the disease is becoming more leana vasta, because from the genetic predisposition, we are seeing the patients coming with PCOS. So Ritu is also getting affected. There are lots of irregular cycle, most of the cases. And even if it is regular, we have anovulatory cycles. Even if it is a ovulatory cycle, we see that the ovulation happens somewhere at around 20-24 days like that. So Ritu is being affected. Then coming to Kshetra. What happens to Kshetra? Is Kshetra only the uterus? No. Kshetra is the whole female body, right? So coming to Kshetra, this PCOS affects from head to toe. Every single part is being affected because of hormonal imbalance. We see there is a change. And coming to uterus itself, even if the conception occurs, there are highest rates of getting miscarriages also. So we see that there are lots of cases who have chemical pregnancy or a very early abortion in PCOS cases. So Kshetra is getting affected, and uterus, we see with repeat Uttaravasti, there are very good chances of getting conception in these cases. Coming to Ambu, the nourishing fluid or the Adhyarasa Dhatu or the endometrial cells, the cells have fluid which actually supports the early conception. So even that is getting affected. That affects the conception, or in PCOS, even that is getting affected. Coming to Bija, we know, anovulation happens and oligo-ovulation sometimes. Even if sometimes we have ovulation, the quality is not good. Okay, even if the patient has, most of the time it is the dominant follicle formation itself. We see no dominant follicle formation in the scan. Even sometimes if the dominant follicle is formed, there is no rupture. So that forms into a follicular cyst. So many times this, especially anovulation and amenorrhea, we feel that the stubbornness of PCOS cases are increasing day by day. So I can tell, being in practice for almost 16 years, what we saw a decade before is not what we are seeing now. I think all of you, most of the senior doctors will agree to that. What they are, the ease at which we were treating PCOS is not the same ease at which we are treating it now. So that's a huge gap or change that we are seeing nowadays in Bija. Okay, all these 4, 5. What about the next one? Saumanasya. You see, lots of hormonal imbalance also causes lots of emotional imbalance. We see that the patients get into a mode of depression. There is lots of psychological issues with these patients. Many a times they have maybe because of repeat anovulation, maybe because of certain amount of infertility for longer duration, they get into a depressive mode, and there is no belief at all. That is totally gone. They get into this mode where it is very difficult for us to divide. Why this is important? We know Saumanasyam Garbhakaranam Shreshta. What will happen here? Many patients I have seen, when you treat them, when they start ovulating, still the conception gets a bit delayed. I generally ask the patient to take some off and go outside the house and then spend some time. Generally, they do conceive during that period. Okay, so what is the important factor here? It is Saumanasya. So sometimes couples feel, no, we both are taking leave, we will be at home. Is that enough? No, that routine has to be broken, because unless until this whole routine is broken and they're totally relieved of morning do the cooking, do everything, that whole routine is broken and they have a peace of mind, is when they actually conceive. Even if you treat, if she starts to ovulate too, the chances of conception, because Saumanasya is involved, will be a big question mark. So that has to be taken care of. So I had a patient, chronic PCOS. She was having anovulation. Her cycle, she was a thin PCOS. So she was having anovulation. She was also having hypothyroidism. So that was maintained. She started ovulating after a couple of months. But then after some time, we saw that she was not ovulating. Then I started giving her Vasti. After Yoga Vasti, she ovulated that cycle. We were pretty happy because that ovulation happened after 2-3 cycles. So conception did not happen. So next cycle, we waited, no ovulation. Again, we did Vasti, there was ovulation. It became a pattern where she was ovulating only after Vasti. She is so fixed now. No, madam, you please give me Vasti every cycle. We don't generally give that. Please give me Vasti, then only I'm going to ovulate. She was so fixed in that manner. Though, so after some time, I said, no, we are not going to give you medicines or Vasti. Just take a gap. There was lots of family pressure on her. She was totally, suffering. So, but when the couple came, they understood. I said, you do believe me? Yes, we do. Then take this. 2 months at least you take a gap. No medicines whatsoever. Just take your medicines. Ayurvedic medicines were given for thyroid. Just take those medicines. You will not believe, she came to a condition where we need to stimulate her for cycles too. Either Rajapravardhini or Dronapushpikalka, something to give so that she used to ovulate. That cycle, when she stopped all the medicines, she ovulated. She had a regular cycle. So many a times this Saumanasya is very important. Though we may advise, the patient will be like, no, madam, I'm a very cool patient. I don't take stress. You don't take stress. Like, that's what you feel, because your body is showing the changes. So this Saumanasya is very important. Psychology, counseling is very important. I generally take, if an infertility couple comes, I take almost 45 minutes to 1 hour for counseling itself. Many people come inside and start crying because there is no answer for them. They have been trying for so many years. So this becomes a very integral part of our practice. So this also is affected in PCOS. Coming to Apanavata, Apanavata is the main source of force which pushes for ovulation, which also helps in conception. That is also affected in PCOS. Overall, every single point which helps in conception are all affected in PCOS. Right? One second. So, what is PCOS in Ayurveda? Do we have a direct reference? No. Can we name PCOS as a single entity? No. Can we tag a particular disease? to PCOS or a condition maybe Artava Vyapat or Yoni Vyapat to PCOS? No. Because we understand it is a symptom, there is a root cause for so many other causes. So as I've already told you, my thesis topic was Pradushtartava. So a clinical effect of Saubhagyashuddhi Dvitiya on Pradushtartava with special reference to PCOS. Why Pradushtartava? Because you see that Pradushtartava becomes one of the causes for many Yoni Vyapats, right? Pradushtartava is given as one of the causes of Yoni Vyapat itself. So that we have taken as PCOS. That we have taken as PCOS. Charaka tells that Pradushtartava is one of the important causes of all the Yoni Vyapats. We see the Bija Dosha also becomes a cause. Bija Dosha is also attributed to PCOS. Bija Dosha, Artava Gata Bija Dushtihi. Artava Gata Bija Dushtihi. Artava, we take it as Dhaturupa Artava as well as Bija Rupa Artava. I mean, Rajorupa Artava as well as Bija Rupa Artava. Whereas Bija Rupa Artava, when we are taking, this is Artava Gata Bija Dushti. So that itself, there is a Antarbhaga which is getting Dushti. So that Bija Dosha is taken. Vagbata mentions about Bija Dosha where Striyo Janmakale Yoni Arambakasya Bijasya Upahatatvam. He is telling that during formation itself, now how we are telling AMH is increased and that is creating an environment to get PCOS in the Bijakala itself. Right now that is being taken as one of the theories. So there is a existing hypothesis that high concentration of AMH which is present in pregnant women could heighten the offspring chances to develop PCOS in adulthood via impact of AMH on neuroendocrine and ovarian function of the offspring. So this is a quote from the research paper that I have taken. So this they are telling during the formation itself, Bhagavad has very clearly explained Striyo Janmakale Yoni Arambakasya Bijasya Upahatatvam. Even from the beginning itself, in the embryonic stage itself, there is a chances of formation of PCOS. So, what do we see PCOS as? Many a times we see it as Artavakshaya, because Pradushtartava can lead to anything. It can lead to Artavakshaya, it can lead to Atyartava, it can lead to Kshinartava, Nashtartava. These all are again manifestations of Pradushtartava. So coming to Pushpagni Jatakarni, that also we see very clear, Stula Lomashagan, Hirsutism is very clearly mentioned there. So we can go into details, but we are not taking Pushpagni because much detail about treatment is not mentioned there. So coming to Artavakshaya, we see PCOS in many cases. And why am I telling many cases? Because there are different presentations again. In many cases, we see that there is Artavakshaya. Etochita Kala Adarshana, Alpatava, Yoni Vedana is also there. In this, when we are telling Etochita Kala Adarshana, we can take it both as amenorrhea as well as anovulation. Then coming to Alpatava, we can say oligomenorrhea as well as hypomenorrhea as well as oligo-ovulation. And dysmenorrhea is also associated because we see most of the girls with PCOS also complain of dysmenorrhea. So generally what we are telling, generally our body is the best doctor. So the woman desire of Katu, Amla, Lavana, Ushna, these kind of food is being desired by women. So Viparita Guna Icha is also there. So we see that this is when we introduce these kind of food, there's a good change in the body. So along with this, we also advise Tila, Masha and all. When we see there is a Artava Kshaya. So Agnya Ushnas are given. So is this the only pattern that we see? No, we also see Kshinartava where there is an ovulation or amenorrhea, but we see the involvement of Vata and Pitta. Vata Pitta Abhyam Kshiyate Rajaha. So in that we see that the most of the conditions we see the woman is a thin PCOS patient. In Kshinarthava, most of the time it is obese PCOS or few conditions where we also have thin PCOS. And Vata Pitta Abhyam Kshetarja, we see that the patient is a bit thin and there is lots of chances of menorrhagia too in that case in those thin PCOS patients. But many a times Pitta Kshaya is also seen and we see Kshinarthava. In those conditions, generally we go for Vinechana and we also if Pitta Adhikya is there and if Pitta Kshaya is there, we go for a Agneya Dravya as a treatment. Then coming to Nashtartava or Anartava, similar presentation, we say Dosha Avrita Marganam to Apravartanam. So here what is the dosha? Dosha Avrita Marga, when they tell it is the Kapha. Vata Kapha Avrita Marganam to Apravartanam. So Apravartanam, when they say about Nashtartava, they say very clearly Pravartamanam na drishyate, natu sarvatakshayam yati. Only the pravritti, pravartamanam only is na drishyate. It's not that it's totally absent. It's not that there's a early ovarian failure. Nashtatva is not that. Because the moment you say nashta, we think about ovarian failure. But they clearly tell it is pravartamanam na drishyate, natu sarvatakshayam yati. So we don't see the pravarti of ovulation as well as the menstrual fluid. So amenorrhea and anovulation again. And we see that this gets a very good. Sushita mentioned that we have to go for Matsya, Kulatta, all these Jangala Mamsa and all are advised. Tila, Masha are advised. They also advise Shatavari, Shatapushpa and Lashuna. So this is all Ushna Dikshna are advised in these conditions. Except when the condition of menorrhagia is present. Other conditions, most of the time we go for Kapahara Chikitsa. So then, see, as doctors, we keep learning over years, over decades, we keep learning. So when I was doing my PG, the concept of Kaphadushti in Dhatus, I did not think. So I attended a seminar of another doctor. So there they were mentioning about Kaphadushti in Dhatus. I went back to Ashtanga Sangraha and took it out. So we see that when Kaphadushti happens in these Dhatus, there is mentioning of hirsutism and all directly in the textbook. So in these conditions, we see that Dhatusta Kapha Roga, which is mentioned in Doshadi Vijnaniya in Ashtanga Sangraha, Sutrasthana, 19th chapter. There's a very beautiful explanation where they say when the Kapha Dhatu is, the Kapha dosha is increased in all the Dhatus, what will happen? So let us see only the Kapha dhatus. Asti we will not take Rakta. In Rasa, Stabdam, Shvetavabhasta is there, anemia will be there, the paleness will be there, and the Mamsa we say Arbuda is there, Apachi is there, though we do not see Apachi, we see different growths which can be taken as Arbuda. And we when the Kapha is more in the Vedas, we see that there is Stulata as well as Prameha, which is mentioned, that we see in PCOS. When it becomes more leaner, in Shukradhatu we see Shukra Sanchaya, where Sanchaya, Chaya happens of the Shukradhatu in the Swasthana. Chaya is only Swasthana Vriddhi. Where do we have Swasthana of Shukra? Shmasru is again Sthana of, the Kitta of Shukradhatu. There we see that Smashru is increased. So, hyperandrogenism, also seen as hirsutism, is clearly mentioned. So, this is one view which I learned. So, apart from that, if you see, in most of the cases, we see that it is very good when you are going for Kaphavata Chikitsa. And in some cases where there is Lena Avastha, you will have to improve the Dhatu Pushti, because many a times even Vata becomes one of the sole reason for Anarthava or anovulation in PCOS. Moving, right? Yeah. So coming to Ayurvedic management. So what do we see? How do we manage? Just as a whole can we take PCOS? We cannot take because every single presentation is being very different. Overall, what we understand is we either split them into lean PCOS and obese PCOS, or sometimes we do split as the Artha Kshaya as well as Artha Vriddhi. So coming to general line of treatment, we see that Deepana Pachana works a lot. Many cases, my thesis drug, as I told, it was Saubhagya Shunti Dvitiya, mentioned in Baishajya Ratnavali. So this is a very good medicine, had a very good, very positive result with this. So that is there. Along with that, Deepana Pachana, we see that based on the condition, we go either for Katu Deepana or Tikta Deepana. If it is Kapha Praya, we go for Katu Deepana. If it is Pitta Praya, we go for Tikta Deepana. So for example, we go for either Trikatu, we can go for Guduchi too, based on the condition. So Pachana is also very important because we understand that Ama is the main reason to form Pradushtartava, because when Adya Rasadhatu is not formed properly, its Upadhatu is not formed properly, thus leading to Pradushtartava. So we have to correct the Amavastha in the beginning itself. Sometimes we see whatever you correct, it's not getting corrected. Give Deepan Vachana as a regular medicine, because these patients nowadays, diet becomes a very big issue. So there is constant formation of Ama and Leena Vastha is seen. So repeat medicines are being given. So we see that there is a very good result with simple Chitrakadi Vati itself. We can also go for anything which we give for Amavata. This I have tried in many cases. I also give Gomutra Haritaki. Result is very good. Then Kaphavata Harachikitsa, that we also call as Vasanta Ritu Paricharya. So that is given because Kaphavata Harachikitsa is very important. So we say that Grishma Prayo Marutpite Vasantaha Kapamarute. In Kapamaruta or Kapavata condition, Vasanta Ritu Paricharya should be given. There's a direct quotation. So what do we give? What is that which is very important? We go for Tikshna Vamana. In cases where you see Vata Kapha is more, many a times we need to control the Kapha and then control the Vata, right? So in these conditions, especially when there is obesity, we see that there's a very good result with Vamana. Tikshna Vamana, if you're not able to give, at least normal Vamana can be given. Dhumana is given. And Gandusha, Navana, Vyayama, Udvartana, all these are advised in Vasantarutacharya. If you see, if the patient starts to follow a proper Dinacharya, because we do go and give talks in different colleges, so I advise them to go for a proper Dinacharya when you are dealing with PCOS. When that is being done, you see that the cycle gets regulated and most of the conditions, dysmenorrhea reduces without even giving medications. So that is something which we can change at a very basic level. So one of known doctors here in Bangalore, she is doing a research on PCOS, mainly with diet as well as intervention only in lifestyle. So that becomes very important. And when we are telling about Vasanta Ritu Paricharya, we have to keep in mind that Kapha is predominant here. And because Kapha is predominant, you cannot go for much of a Snehana, right? So you can advise Abhyanga, but followed by Udvartana. So that is very, very important. So generally, when I advise my patients, I advise them to go for all regular Dinacharya. So if not, at least most of the patients are pretty young. So Brahma Muhurta becomes a very difficult task. But yes, some patients do take this advice, and some patients, when they get up, they at least try to do most of the Dinacharya. So for Atish, we also advise them a proper Nasya, because we have seen that Nasya also is regulating the cycle. Normal Gandusha will also improve, because when digestion is improved, you see that there is a very good impact in the metabolic disorders. So that is advised. Nasyam Vyayama, very, very, very important because this has become a very, very sedentary life nowadays. So Vyayama is very important. If there is no time, if the climate is not good, at least, I ask them to jog wherever they are. Just wear a shoe and jog. If you are busy, if you are in meeting, or if you are doing some, listening to something, put your table, just jog wherever you are standing. That helps. So many of my patients ask if walking is okay. Walking is okay, but it's not enough because the PCOS fat is stubborn. So you need to have a little more impact. So that's why the Tikshnata is given importance here. So excessive, you need to strain yourself. You need to have a proper sweat. So that is advised in Vasanta Ritu Paricharya, where they say Vyayama and Udvartana are a very integral part of the Paricharya. Then coming to internal medicines, have they been advised of where do we take the reference? We all advise honey. Intake of honey is very good, and we all advise them generally, to reduce the glycemic index. Goduma is a better choice than the rice, so that is also given. And madhu and water is given, and we also ask the person to take udashidvat, which is half churn the butter curd and add half water. So that is given. Udashivat is given, and Guru Shitala, Divaswapna, as well as Amla and Madhurapraya Ahara are contraindicated for these people. And water should be boiled. So there's a reference of using Kadira Jala. Kadira, though we know it is Pushtagnanam Sreshta. Generally, if you go for Sahasra Yogam reference, there is a Kanjika reference with Kadira. Okay, so it goes on to say that we have to use this Kanjika, which is prepared with Laja, Mudga, which is boiled in Kadira Kashaya. So I had a patient, obese patient. So this is given for all the Medo Vikaras. So this being one of the, Kapha Pradhanya Vyadhi, I also give it in all PCOS cases. So this patient was obese patient, not PCOS patient. Why am I mentioning is, I just want to give that context, how fast acting this is. So this, I advised her, we were doing Udvartana for the patient, and I asked her to go for Kanji 1 time per a day. Okay, not the Kanjika, not the Amla Kanjika that we prepare. I told them to go for a normal preparation of Kanji, where we boil. I asked them to prepare Kadira Kashaya, filter its cloth because it gets into, it irritates you. So that Kashaya you put and prepare a Kanji of Laja and broken Mudga. So this she has to take as dinner. So one meal she has to change it into this Kanji, I advise her. So this went on for 15 days. This patient, why she came to me is to reduce weight so that she had an issue with the lungs. Okay, there she has to undergo some surgery. So that's when she came. After this treatment, actually, all these conditions came down. So this is a very good for all the Meha Vyadhi. It is very good. I give this in PCOS, especially obese PCOS. I give this for them to substitute this as one meal, preferably in the night, because morning it will be a little bit hectic to prepare kashaya and then make a kanji out of that kashaya. It's difficult. So I ask them to prepare this as one meal at night. The result is very, very, very good. So that is one very practical application of Kanjika that we see, because Kanjika, it asks the sins. Kam jiviyami aham. Kanjika itself asks. So this is one of my guru, Dr. Ramashastri's favorite quote. So Kanjika asks the sins, Kam jiviyami aham. Whom I should protect is what the Kanjika asks. So include Kanjika, which are lots of references are there in Sahasra Yoga as well as Vaishratnavali. You can go for those references and prepare small Kanjika. You can ask the patients to prepare. So this is generally given, and then we also go for Shodhana. Generally, when you say Shodhana, we mean Vamana rather than Virechana, especially when there is a Kapha Adhikyata. So Kapha Upakrama also is similar because Vata is Yogavaki. Kapha Upakrama, which is mentioned, is also similar to that of the Vasanta Ritu Paricharya. So we also ask the patient to go for taking only hot water, right? Hot water, especially boiled with kadira and trikatu, dania, like that. We ask them to boil and have this hot water as a everyday instead of normal water. There also we are finding very good result. So coming to symptom-wise management. Okay, this is all fine. The patient comes to you. Many a times they come with long-standing amenorrhea. So I had my student when I was working in SDM. So this student was having amenorrhea for the past one year, 2-3 months, almost 1.5 years. This patient has tried everything. So when she came to me with amenorrhea, believe me, I tried everything possible. Because she was not ready for Shodhana, that age, and then exam was there. So she cannot take leave, clinical classes will be missed. So she was like, no, ma'am, please give me only internal medication. I started giving her everything possible. So as a doctor who has been practicing, especially for PCOS for almost more than 1.5 decades, it's like, nothing was working out. So I said, see, there is no other go. You have to undergo Vamana. She took Snehapana properly. On the day of Vamana, on that night itself, she got cycle after 1.5 years. Is this a single case? No. Most of the cases we see that either they get the cycle during Snehapana or they get after the Vamana. There's a very beautiful change. So amenorrhea, when we take, nowadays we are having amenorrhea, which are very stubborn, right? So especially when we talk about all the symptoms, because many cases also have PCOS asymptomatic, right? When you go for scanning for some other reason, you find that there's a PCOS. So in my patients, when I did my thesis work, so I had almost in my 30. We had to do 30 patients during those times. So almost I took 42 patients. A few dropped off, and then few could not continue the treatment, though they were taking medicines later. But I did not include that in the thesis frame. So among the 30, I had 12 people who were obese. So in these obese cases, what I have given the Saubhagya Shuddhi Dvitiya, which is very good Dipana Pachana, as well as this corrects the Adya Rasadhatu itself. The very good result is seen. I have seen that among them who were obese and having irregular cycle, 8 of them got a very good regular cycle in 2 months itself. 7 of them have very good change in their weight also. So we see Deepanapachana works in these cases. Then coming to other conditions, we see amenorrhea a lot. Amenorrhea, oligomenorrhea, hypomenorrhea. These cases have responded very well with this treatment. Then coming to infertility, I had 15 in my thesis. I had 15 people who were married, 15 were unmarried. In that, among the 15 unmarried people, 4 were already having children. So that was only PCOS condition, not infertility. So infertility we could tag only after 1 year. So 4 infertility cases were there. Though many were married and waiting for kids, it was not crossed 1 year. So among them, among the 4, 3 had conceived. Okay, so that one person also conceived after 5th month of treatment. So 3 months only we take the arbitrary study. And coming to other patients who were married but not infertility, the term infertility cannot be used because they did not cross 1 year. So those people, among them, almost 4 conceived within that year. Because when I presented my thesis, it was most of them were already conceived. So that was the condition. Then coming to anovulation, we see stubborn anovulation. Many a times you do give simple as little Deepanapachana around the ovulation time or Nasya around the ovulation time do work. So I'm not denying the fact. But there are cases where you do everything and there is absolutely no response. So those cases are also increasing. But back in those days when we were doing, I did not go and study anovulation. as a part of my thesis work because scanning we did not get it done, so I did not include that. Coming to menorrhagia, I had among 36 people were having menorrhagia, others were having either scanty or spotting or amenorrhea. So among the 6, only 1 got result. So when you are going for Deepanapachana, because obesity is a Katu Deepanapachana, so we have to understand that we cannot give that in menorrhagia conditions. We have to go for Tiktapachana only. So then next, coming to symptom-wise management, we see that when we get amenorrhea, generally what we do, every time our amenorrhea patient comes, we give a basic Deepanapachana Ushta or Anulomana, we give, right? We ask them to go for either usage of papaya or til laddu. All these general advices are generally given. We see some of the patients do respond, some do not. So when you get a stubborn case of amenorrhea, I generally ask the patient to go for a scan. If we see that the endometrium thickness is good, then you can go for a normal medication like Deepanapachana or Rukshana or even Anulomana, it will work. I have given Yoni Dupana also, wonderful. There is no mentioning of this, but I have tried these in quite a number of people in SDM. After, my colleagues also tried the same. Result was pretty good. I used to give Shatapushpa Yoni Dupana. We had a Yoni Dupana chair in SDM. So we used to put Shatapushpa in the Dupana Yantra and then ask the patient to sit over it and cover herself. So that was giving without even internal medication. So if the endometrium is thick enough, whatever simple management you can give, most of the times, there are cases where the endometrium is 11 mm and then still they don't respond. But 99% of the cases, they do respond beautifully if the endometrium is thick enough. If the endometrium is thin, then what you will do? If the endometrium is thin, you have to understand that you need to improve the endometrium. You need to improve the Rasadhatu, whose Upadhatu is Artava, which needs to be properly accumulated in the uterus for it to flow. Masa Nishtadahar 3, right? It has to be formed and then it has to be let out. So for that, we go for basic Deepanapachana and then start with Snegapana. So in Snegapana, I have seen that I have been using Dadimadi Girta and Shatavari Adigrita, but maybe before some 6 years, I think, there was one very senior doctor, Dr. Ramesh sir from Bangalore. He advised Pipalya Adigrita. That was the first time I started using Pipalya Adigrita. It is wonderful. From then on, I am giving only Pipalya Adigrita because Dadimadi Grita works very well. If there is Mudavata Anulomana you need and there is totally unresponsive cases, you can go for Dadimadi Grita. If you see that Rasa Rakta Dushti is there and then that needs to be corrected, you can go for Pipalya Adigrita. So how I give it? I give 2 teaspoons only once a day in the morning after correcting her Agni. In the morning, she is supposed to take 2 teaspoons followed by a glass of hot milk or hot water. Based on her condition, you can advise. So that I give Dadimadi Grita. Shatavari Adigrita is very good at improving the endometrium. So that can be given. And if the endometrium is very thin, say 4 mm and all, in those cases, Pipalya Adigrita is working very well. If the endometrium is around 6-7 mm, even if it is beyond 7 mm, but it is unresponsive, in those cases, Shatavari Adigrita is working. Dadimadi Grita, generally, I prefer when the patient is more of Vata Dushti, I prefer Dadimadi Grita. Mudavata Anulomana happens and the result is good. And then coming to other medicines, when the endometrium is thick enough in amenorrhea, we generally use many medicines like Rajapravatini nowadays it's not working, you all know. Only few company medicines work. So Rajapravatini I stopped using and I started something called as Arka Pushpa Yoga. So this is written in a book called Vaidya Chintamani, Dr. Surendra Sharma sir from Hyderabad. So I learned it from him. So he told that we need to prepare Arka Pushpa Yoga. Every clinician can prepare this, every practitioner can prepare this. You just have to collect Arka Pushpa, anything, either white or the violet one. Collect those Arka Pushpa, deep fry it in tilak clean it. If you want, you can wash it well based on the place that you correct. You can wash it well and shade, dry it. Then deep fry it in tilataila. Okay, after frying, take it aside. Let the oil little bit come down. Weigh it. So maybe example I'm telling, if it weighs 100 gram, 2 times you have to add guda. So 200 gram of guda you have to add. You have to put, you can either use kalvayantra or you can put it in mixie, much more easier, and make 3 gram laddu. That is Arka Pushpa Yoga. I add, that is the formula. I add Tankana Basma to it. Extremely good result is there. Many cases, I'm not telling all, because nowadays we cannot say one medicine fits all. So most of the cases do respond very well. They get the cycle within 1 week of using this. So this I give 3 grams thrice a day, followed by either tilakashaya or hot water or kulatta kashaya. Anything you can give. So you have to ask them to be on a little diet. You will feel that the body temperature increases. They may get some mouth ulcers too. So the Arka Pushpa is very safe. No need to think of toxicity because it's only Arka Kshira which is toxic. So this you can aram se use. It is very, very effective. This is Arka Pushpa Yoga. So this is one I have improvised it by using Tankana Basma. You can improvise it with your own yukti. So Drona Pushpi Kalka I use in amenorrhea cases. Drona Pushpi leaves, I ask the patient to collect 5 leaves. It is given thrice a day. 5 leaves are taken for one time. Crush it either directly if the patient feels, I'm taking only this, not the medicine. Give to Rajapravartini, also ask them to crush it and then just take it as a kalka. Eat it as a kalka. Morning on empty stomach, evening at around tea time. 2 times is enough. If the patient can bear it, you can give it for 3 times. I generally go for 2 or 3 times based on the stubbornness of the presenting patient. So Drona Pushpi leaves, there is no reference. There is no textual reference that you can use this. Beautifully, I have learned it from a patient. So this was some North. She is from North. I don't know which state. So this patient said she has been using this from her native. So that is when I started using it in my patients. Very good result. I started telling to everybody, because when the patient comes to Ayurveda, we have to cure it. So it is our duty that we have to educate that this is pretty much fast acting, right? So Drona Pushpi Kalka acts extremely well. So that is also for amenorrhea cases we use 3 times per day or 2 times per day for at least 5 to 7 days. Most of my students, when they ask me for medicine, I don't give medicine, because I tell them as doctors, you need to experiment, understand what is happening. Small changes with food, basic Deepanapachana or something like this. If you are able to correct the cycle, then why use medicines, right? So I tell them many people have started using and growing it in their homes. Drona Pushpi, they started growing because such a simple medicine that works very well in amenorrhea cases. We use RP Vati, we use Chitrakadi Vati. I also started using Gomutra Haritaki, having very good result. Generally, we go for Kulata Kashaya or Jerakadi Kashaya, or I want to mention for almost 14-15 years, I have been using my medicines, 3 Hita. I have launched it recently, but I have been using since ages, and many of my friends have also used it. Now I supplied to for almost 250 doctors. So having very good results. 3 Hita has all the things which are mentioned in amenorrhea, like Shatapushpa, Shatavari, Trikatu, Nagakesara. It stimulates ovulation. It has Trivanga Basma, which is also a Rasayana, as well as Shroto Shrodaka, especially for the women. So that is all there. Wonderfully, results are seen. So in the success cases, I have posted few cases only I have taken, because this discussion would go on for some time. So I thought I'll just take 4 or 5 cases and present it. So you'll see that within 1 month of usage, the ovarian volume from 26 is coming to 11. So that is the fast acting medicines that we give. I'm not telling that this will act that fast in all the cases. So it depends on patient to patient also, because if the patient is born with a genetic predisposition, it will be much more stubborn for us to treat such cases. So coming to menorrhagia as a symptom, if you see, especially PCOS and menorrhagia are a very bad combination. So results are very good when you are using Ashoka Churna along with Yashada Basma. So in say 50 gram of Ashoka Churna, I add almost 2.5 to 4 gram of Yashada Basma. I ask the patient to take it quarter teaspoon to half teaspoon twice a day with honey. Very good reference. This is from Rasa Tarangini. So extremely good result is there. But in some cases where you get thick, heavy flow, and then with lots of clots, with pain, we see that the result is better when you start them off with little Pittahara or Samapitta Chikitsa from one cycle prior itself, not during the bleeding phase. So we see that Tikta Pachana is very, very, very good. Grahi is something which we more than Stambana. So Tiktakam Kashayam, Vasa Guduchadi, and Guduchadi Kashaya, these and all we use regularly if the patient is lean PCOS especially and presenting with menorrhagia. So in these cases, we also go for lifestyle changes. We ask her to take intake of Grita is advised, especially Ashoka Grita or Tiktakam Gritam is given. So that also gives a very good result. Apart from that, when she is having bleeding, that you need to manage. So most of the time I give, if Grati is not working, Stambana has to be immediately done. Okay, if the patient is having Rakta Pitta Chikitsa, we give. I also give lots of food changes. I ask them to stop urad dal. I ask them to stop all non-vegetarian food. And banana flower juice is something which I generally advise the patient. I ask them to make it into half flower banana, half banana flower you take and then cut it into pieces, because I don't know whether you use, like in South India, we do use banana flour as cooking medium. We remove the outer rind. We remove, there is something called kallan, which is a thin strand which is inside. That also we remove for cooking purpose. But here we do not remove anything. We just ask the patient to cut it into small pieces, put it in mixie and make a juice out of it. That juice we can have it freshly prepared, half banana flower juice in the morning, half banana flower juice in the evening for 3-4 days. Very, very, very good result is there. Most of the conditions, because I do treat people over abroad and all, where the availability of medicine is a bit difficult, I do treat only with lifestyle as well as diet changes also. So in those conditions, this banana flower juice works amazingly well. And I generally use that for many of my patients. In some patients, especially when the vata is more, you see that the bleeding increases with this banana flower. I also ask them to either go for touch me not, Lajjalu Swarasa or Durva Swarasa. All these act very well. So that is how we manage menorrhagia. And then coming to anovulation, we have wonderful result, especially with Vamana, and we have very good result with Vasti. Vasti, when we go for Vasti, in anovulation, again, when you see either formation of dominant follicle itself is not there, or the dominant follicle is formed and rupture is not there. So if the dominant follicle is formed and rupture is not there, for anovulation, Nasya is also in. But in some cases where dominant follicle is formation itself is not there, in those conditions, you can go for Yeranda Muladi Kashaya Vasti. So that acts very well. If the patient is obese and formation is there but rupture is not there, you are seeing hypoovulation. Some cycles only it happens. In those conditions, we go for Lekana Vasti. That also has very good result. In anovulation, we also ask the patient to go to take a regular Nasya from 6th day of period till ovulation. So I'll share that. I have not posted in the success cases. I'll share after the talk. I mean, after the success cases are over, I'll show one more case where I just asked the patient to go for Nasya. No internal medicine was given. Only Nasya. 12th day scanning, no dominant follicle. 14th day, no dominant follicle. So from 14th day, I think 13th day, I started with Nasya, and she ovulated on 20th day. Okay, so anovulation has very good result with. Apart from that, what you can give? You can give a little Ushna Dikshna Chikitsa. So you can go for, Chitrakadi Vati, or you can also give Gomutra Haritaki just a few minutes, few days before ovulation. That also works very well. So coming to infertility, that's a burning topic. All these conditions that we are discussing are also leading to infertility. Anovulation leads to infertility. We see overall when you treat this as a cyclic panna, taking care of everything, single thing like diet, lifestyle, medicine, the results are as quick as 1-2 months also. Sometimes there's a delay of 6-7 months also, but rest assured, giving panchakarma, giving the medicines, the result is very well, and results are pretty promising. And coming to acanthosis nigricans as well as hirsutism, we see the result is not that great in hirsutism. That's my experience. Maybe other senior doctors may differ. Acanthosis nigricans, I generally go for Rakta Shodhaka as well as application of different, we do give some applications. So basic, say, what is this? Spatika Basma, as well as, Kadira and Rakta Chandana. These kind of applications we do, we ask them to go for little scrubbing in that area and apply it. That result is okay. But hirsutism, I found the result is not that great. Coming to role of Panchakarma, Shodhana, especially Vamana, is definitely indicated. Wonderful result is there. But if you feel the patient is a thin patient, and then Pitta Dikyata is there, then Virechana can be advised. Okay, even in cases of obese patient, but you are finding menorrhagia, Virechana is advised. Most of the cases, you will feel that Vamana is the best line of treatment. Coming to Vasti, I either give Lekana Vasti, especially if the patient is obese. For obese PCOS cases, we go for Lekana Vasti. Within one cycle, I generally, when I do the cases, I ask the patient to go for scanning immediately after Vasti. I don't wait for a month. I tell them, take scanning on 8th day, 8 days, Yoga Vasti, 8th day itself, I ask the patient to go for a scan, or maximum 9th day, I ask them to go for a scan. See the difference, because this needs to be done. The patient needs to understand how fast acting our medicines are. So not only in these cases, in many cases like fibroids or endometriosis also, we see there's an immediate, shrinkage of the fibroid or PCOS or ovarian cyst. That gives the patient also confidence. So when you're telling Patya, they are bound to follow, because you have given them that confidence that this is how our medicines are going to act. So Vasti is my favorite. I have tried almost all my cases. I do give Vasti, especially in gynec diseases. Vasti is like Amrita. It is not Chikitsa, it's Chikitsa itself. So Yoga Vasti I give generally if the patient has calm time. Then there was like one case of stubborn PCOS anovulation. We have given every medicine possible. Vasti was given, Yoga Vasti was given, nothing was working. Then we gave her Kala Vasti. So that is when her body started responding and she conceived in the very next cycle. Okay, so only one. All these months, whatever we have given, nothing worked for her. She's a very thin PCOS case. So for her, we gave this, and she is blessed with a baby girl now. So that patient conceived immediately after Kalavasti. The next cycle, she conceived. So Kalavasti is also very good, especially when you are seeing there is a Vata Dikyata, there is your dominant follicle formation itself is not there. In those cases, go for Yerandamuladi Vasti. That I have found very good result. Coming to Lekan Vasti, we have formulated a particular Vasti where we give, it's not a traditional Lekan Vasti where you add basmas and all. I generally avoid that. What I give, I take 5 grams Saindava. I generally accept Yavakshara. I do not add any other Kalka, because we are giving in the NIMA-Can. Adding Kalka is becoming an issue because it's not going. Normal Vasti, many people are not giving, they are using the NIMA-Can. So that we add 50 ml of honey. I add in that 20 to 30 ml based on the patient. If it is a very obese patient, you can go for, almost 30 to 40 ml of Gomutra. Okay, so if you are going for Gomutra, dilute it and use it. If you are getting a fresh Gomutra from a healthy cow, so generally we do have sources where we get healthy cows and cow urine. So we can use direct Gomutra. If you are using direct Gomutra, you can go up to 50 ml also. If you are diluting Gomutra, then don't go beyond 30 ml. That's my advice. And we see that patient may faint also sometimes in the washroom itself. So that I add up. And while preparing kashaya, I add all the other dravyas, like for kalka, whatever we add. So for kashaya, I generally go for, the patient is very obese, then I go for asanadi kwata and triphala or triphala kwata. If the ovarian size or volume is more and that the patient is not so obese, then we go for medium size, then we go for varanadi kwata. But asanadi has a very good result in reducing weight as well as the combating PCOS. So that I add. So say I generally go for ardhamatra nirukhavasti. So if we are going for say 350 ml of kashaya, I add around 100 to 120 gram of patachurna. So, and I also go for adding chincha or the tamarind. I add basically from 10 grams to almost 18-20 grams, strictly based on the patient. And I add shatapushpa in that. I add lashuna kalka in that. In some cases, we also add, yashti or guduchi. If you see that there is, combination based on the prakriti, we add that also. So this kwata is prepared. I filter it, and as a kalkadravya, I add yavakshara 3 to 5 grams. If you are preparing it or if you are procuring it from doctor, then fine. Because when I prepare, when I take it from a known doctor, I add 2 grams or 2.5 to 3 grams. If you are buying from market, you can add 5 grams. Effect is not so great. So you add, and then I add my oil MD4 thaila, very good in stimulating ovulation. So that I add almost 80 ml of that. So this is the vasti that I give for kashaya vasti and lekhana vasti. And for anuvasana vasti, I do either go for MD4 thaila alone, or I mix with varanadigrita and give, or I will go for triphala thaila for this one if it is obese PCOS. If not, we do not go for MD4 because that's again Ushna. I generally go for even Shatapushpa also we can use when you are treating obese patients, or you can directly go for Vatakara, either Kshirabala or Dhanvantra, that like that you can go for Vasti. So there is the Lekan Vasti that I use. Coming to Nasya, we do give Nasya with, I have seen very good result. I'll be presenting the cases also. Stubborn PCOS and stubborn anovulation, MD4 thaila Nasya 2 drops as a Prativarsha Nasya. When I start with 6th day onwards, we are finding very good result and the patient do ovulate and conceive. And I also see similar results with the plain Tila Thaila also. So that also, if you want to try Nasya, then that also we can do. Coming to Uttaravasti, Uttaravasti is something which is very, very, very unique for us and having a very good result. Most of my cases, so you would have, if you are known to me or if you would have seen my, you know that I generally conduct classes on workshop on Uttaravastis. So most of the cases we give Uttaravasti because Uttaravasti, they say that you can give for all gynec disorders. So in PCOS, one of my colleague in PG, Dr. Sarita Nihar, it was her thesis of giving Narayana Thaila as Uttaravasti in PCOS. Beautiful result was given. Narayana Thaila of one particular pharmacy called Chintaluru Pharmacy, Venkateshwara Nilaya, Ayurveda Nilaya, that's in Andhra. There, Narayana Thaila is not the Narayana Thaila that we use for pain. So that is a different preparation. So that is one that that was her thesis and that we use. I also give Shatavarya Digrita if I want to improve the endometrial quality. I give MD4 Thaila if I want to reduce the cystic size. If there is heavy bleeding, we go for Ashoka Grita. If it is only to improve her fertility, we also go for mix of Falagrita as well as MD4 Thaila. So different combinations you go and give for Uttaravasti. So when you are giving Uttaravasti, because 2 days back. I think I listened to Uttravasti in NIMA itself. It was such a beautiful presentation and such in-depth research knowledge that Madam had. So very inspired and very happy to tell that I have been doing almost 1,500 Uttravastis minimum per year will be doing. So many years, 16 years I've been practicing, and Uttravasti becomes one of my favorite, as well as Vasti and Uttravasti are something which I generally use in almost all my cases. Yeah, one thing what you have to be very careful of is when you are using Ksharataila. So as rightly mentioned by ma'am also, my guide, Dr. Vijayalakshmi madam, so she also was a little bit skeptical on using Ksharataila, except in some fibroid cases. Generally, I'm not using now. In those days, I used to use. Now, totally, we have stopped using Ksharataila. If you want a Ushna Tikshna action, then you can go for Lekana action. You can go for many other options, right? But Kshara, I do have used in cases, a few cases, as uric Kshara application and all. But as such, for internally, it's better to avoid. If only if she has crossed her fertility age and then having some other issues where you want to, because if it is a submucosal fibroid, it may lead to heavy bleeding if you're using a Ksharataila. Then we would discuss success cases now. So this is one case where the patient was married for 6 years, conceived thrice, but had spontaneous abortion. Later, she developed PCOS, and cycles were pretty irregular, and she had torch positive. When we say torch positive, it is not torch IG, it is not torch IgM, she had torch IgG. Again, when you go for infertility and see torch, whether IgG is affecting the infertility, no, it will not. You will not get any reference. But over years, what I have understood is people having IgG very high, beyond hundreds and all 200s, 200s. In those cases, you have a very good result when you are putting some medicine. So when you are controlling that, I'm not expecting that the value should come down, but it is just a observation that torch IgG positive cases also go for repeat abortion, as well as they have stubborn infertility. So I generally go for Garbharaksha Kashaya as well as Mahadhanantram Gutika. So this is a regular practice which many doctors use. So that, or sometimes you can go for torchinil also. That if you are giving, or Lagumalni Vasanta or Swarnamalni Vasanta, so that will be under control, and the patient, you see that the patient conceives easily, and repeat abortion also reduces. Many cases I just put them on Mahadhanantram Gutika, which is also called as Garbharaksha Gutika from Kotakal, and Bhadradi Kashaya, which is also called as Garbharaksha Kashaya. This is also from Kotakal that we use, and ask them to continue that throughout the pregnancy. So whatever you use for PCOS, that we ask them to stop the moment she conceives. But these two, we ask them to continue throughout pregnancy. Okay, so I gave this patient similar medicine. I gave her Sukmaran Kashayam, Dharmantram Gutika, Sukmaran Kashayam. I gave her Bhadradi Kashaya as well as Mahadharmantram Gutika. And I asked her to go for Satya Virechana, and I gave her 1 cycle of Uttaravasti. So this patient conceived. So in this, the patient had conceived in 4 months. Okay, and yeah, conceived in 4 months. So this is testimony. So see, if there are young doctors here or students here, I don't know. If one thing mistakes many senior doctors would have done, and I had definitely done, is I failed to take the before after reports for so many years. Now after joining SDM, almost like for the past 6 years is what my collection of reports are. So all these old reports, everything it is lost, because we did not feel the importance to collect before after report. So that was mistake that we have done. I would request you people not to do that. So this is the one case. See, many a times medicines as simple as Sukumara Kashaya, if you are targeting your Apanavata. Simple medicines like Strihita alone, as a single medicine, or Trikatu Nagkesara combination as a single medicine just to stimulate ovulation. Many doctors use such simple medicines also to treat PCOS. So we have been using such medicines, but nowadays in some cases we do go for usage of many medicines because the severity as well as stubbornness has increased. So this is another case where the patient has married for 1 year but anxious to conceive early. She has PCOS. The cycles are delayed. So this patient, I just gave her only oral medication because the patient was just for 1 year and then everything was normal. This patient conceived within 1 month. Because she came just before her periods. After periods, that immediate cycle she had conceived. So this patient, when this is the case. Yes. So this patient, if you see, 12th day she did not, 10th day no follicle, 12th day no follicle, 14th day there is slight development, and this is actually, if you see her LMP 27.5, but this is 24th day. It's not. It is almost 26th day, not 24th day. Follicle, 2 follicles ruptured, and she conceived during this, and this is the report. So this same cycle on 26th day, the follicle ruptured, LMP 25,519. Here also LMP 25,519. So this patient, so internally we gave her Sukumaram Kashayam as well as Trihita, and no, that's all. We gave nothing much because it was just newly married and all. So I thought, why unnecessarily give more medicines? So that's a cycle itself she conceived. So this is another case. The patient was married for 2 years, has PCOS, had anovulatory cycles, and this is Dr. Friend. She was a physiotherapist in our hospital. So I gave her internal medicines, but then she was not ovulating. So then I started giving Nasya for 1 cycle. I gave Nasya. Next cycle she conceived. So this, if you see, LFP 7, 11, 20, 20 in this cycle, though there was no ovulation, if you see 10th, 13th day, 15th day, there is very mild development, and then around 24th day, she went on to have a cyst. So this cycle she did not conceive. She had next period. This also we gave Nasya. Next period she had LMP was 5/12/2020, and after she got the cycle, from 6th day, I asked her to take MD4 Nasya, only 2 drops along with Strehita. This cycle she conceived. So this was a case. It was not infertility case, but this was kind of, the patient was about to get married and very much worried about the reports. So if you see, the right ovary before treatment was 22.5 cc volume. After treatment, it became 8.4 cc volume. Left ovary before treatment is 26.3 cc volume. After treatment, 6.2. When it crosses 10 cc, we call it as PCOS. If you see, it is 22.5 and 26.3. The volume is so huge, right? So this was the condition. I just gave her Strehita for 2 months. I advised her to go for walking, yoga, diet, and yes, I asked her to go for a strenuous walking, either brisk walking or jogging was the condition. Patient is my cousin only, so yoga was given. She also strictly followed this report. So this is another case where the patient, I don't have the report because this we conducted an infertility camp the moment I joined SDM. because I am into infertility for all these years, so I spoke to principal and we conducted a camp as soon as I joined this year. So she was the first patient of that camp. So we didn't take the report, we didn't take the pics. She had irregular cycle, mild dysmenorrhea was there, PCOS was there, and 4 years of married life. This patient conceived within 1 month of using Sukumaram Kashayam and Dhanvantram Gutika. So the beauty is the moment that was a 1 month long camp. So before the camp ended, she came out to be positive. So that was one positive result of that camp. So this is Mrs. Mona Lisa Mishra. So when we see that these patients, when they use, they do go for second conception very easily without any intervention or medicine. As I told, first is what I have showed you. This patient had a male baby. She delivered during the COVID season, so they were there in their native Tamil Nadu. And then when she came back, again she started. She wanted to take preconceptual care. She did. Only I just gave her Virechana and Vasti. She did not take. I gave her Strihita, and I also asked her to take MD4 Thailand Nastya. She conceived. The beauty is she was left out with some Strihita. She went off to her native while taking. So she had some Strihita capsules left out. She gave to her neighbor who was known PCOS case. She also conceived. So I generally don't advise, but sometimes patients have that overconfidence. Yeah, this will work. So this patient we recently gave Hombale in our Prajananam, this one. So she had a very good result in both the times. Though second time treatment was not required, it was kind of preconceptional. And even this patient also conceived second time without much issues. And coming to this patient has a very good result within 1 month. She conceived. Hello. So she conceived, and then next, after 1.5 years of conception, second conception was a spontaneous conception again. That also she conceived. Both the children are healthy. So with this, I want to just give a small introduction to my products. See, being Ayurvedic doctors, it is one thing is to establish practice, and then next is to have effective medicine. Right, you all would be experiencing medicine as simple as Rajapravartini Vati is also not working in many cases. So if you are using Pushkala Badrinarayan for your cases, we see that the result is not pretty good, because when you add Pushkala Badrinarayan, you are getting Amra in it, not Amrasti. Amrasti is Kashaya Pradhana and Stambaka, whereas Amra is Amla and increases bleeding. So that is the quality of medicine that we are getting in market. So I'm not commenting on all the companies, but I just wanted to make sure this was my dream from third year of BMS to start my own pharmaceutical company. I've been preparing medicines from that time itself. So Strihita is something which I have been using as a combination for so many patients, and many of my friends are also using this. Many doctors have got very positive result with this. This I use in all PCOS cases. I just give it as a fertility booster. I give it in PMS also. I give this just for perimenarche cases also, just after menarche, how we use Ashokarishta or Jirkarishta, like that I use this. Very good in preconceptional care, because this care takes care of the quality of egg. So that I am proud to say that many allopathic doctors are also using this. Strihita, they have got very good, one of the known doctor who has IVF center. Madam has used this medicine, which I had given to her as sample. So that case, there was a 19-year-old lady, married for 2 years. So this patient was having lots of stress to conceive immediately, and then they wanted to go for IVF. So ma'am does not, there are many doctors who do not allow you to go for IVF immediately, right? Like, because there's a basic ethical practice. So she tried IUI, which did not work. Then when I gave her this sample, she had put the patient on this Strihita, and next cycle they did IUI, the patient had conceived. Because quality of egg matters. For sperm, you have DFI. For egg, we don't know how to see the quality. We just believe the quality is good. How we know the quality? Only if you are going for IVF. When they retrieve and then see, that's how you will understand. So the quality has improved a lot with Smita in many cases. We're planning for IVF also we give, and we also give for all the cases of PCOS. So that is one. MD4 Thaila I want to highlight because direct reference of Mundi, if you see, it is Yorishulahara. I have used it in extensively in fibroids, endometriosis, and PCOS condition. Nasya I use in almost all anovulatory cases. For fibroids and endometriotic cyst, I give it as Pichu also, as well as Utravasti also. When Pichu is given throughout the month, the size shrinkage is good. I also use MD4 Thaila as a part of my Vasti treatment. So others, MD4 Thaila capsule also I give because it also regulates the metabolism of Ushna Tikshna. We give it to stimulate ovulation also, as well as in other conditions where you need to tackle growth, like thyroid or fibroid or endometriosis, like that. Other two, Oteita is for autism cases and other psychological OCD, ADHD and all we use. Ojaita is for autoimmune disorders. But Strita and MD4, as you're all women practitioners, basically into Prasuptantra and Striroga, I would definitely request all your support. Medicine is good, that much I can guarantee, but support is what I request from your end. Thank you very much. Doubt? Yeah, I said I would share one more case. I'll stop this share and I'll show that case once again. So this is the case. So she was from Hyderabad. I was here in Bangalore. So 12th day she went. She is a case of endometriotic cyst. Okay. Also PCOS. So second, if you see on 12th day, no dominant follicle, 14th day, no dominant follicle. So from 16th day, the development, 10 mm we cannot say is dominant follicle. 16th day, the development started. And the 20th day, she had ruptured. Okay, so this is one case where I gave plain Tilataila because she was not in town. So this is one. And another case I didn't get the report was another case again from Hyderabad where the patient had one of my junior doctor was treating her. So only Nasya was given because the patient was not very particular of internal medication. She was already on other medicines, so she didn't want to take. Only Nasya was given with MD4 Thaila. She ruptured and the patient also conceived. So many cases, like I just there are cases, as I told you, many a times you get some cases where the ovulation you need to stimulate. In those cases, Vasti has become integral part of many doctors' practice. I understand, but I use it extensively, especially if the thin PCOS, Yarandamulari Vasti giving very good result in ovulatory cases. So with this, I thank all of you. I thank NIMA Association for giving such a wonderful opportunity. This is really, there's a huge platform. It is really a dream come true to talk in NIMA. Thank you all. If there is any doubt, whatever, I know, I will definitely share. Thank you.
Thanks, ma'am, for such a wonderful lecture. Now I request today's chairperson, Dr. Amrita ma'am, to share her few words. Amrita ma'am.
Yes, ma'am. Am I audible?
Yes, ma'am.
Yeah, so firstly, I would like to extend my gratitude towards the organizers, that is NIMA Integrated Medical Association Women's Forum Maharashtra, and all the stakeholders including Dr. Saratkar Madam and everyone who have given me this opportunity to be here in August, in between all the learned audience. And firstly, I would like to congratulate Madam for the wonderful presentation. She has explained in detail the different concepts of infertility. She has also mentioned the causes and the different types of management, which includes Panchakarma. So to add to it, I would like to say that Panchakarma is, yes, one of the integral part of infertility management. And we have also been practicing Panchakarma for infertility patients with a good success rate. And as Madam has said, there is no uniform formula as to Panchakarma, which Panchakarma procedure is to be followed for infertility. It depends completely on the cause of infertility and also the duration of infertility and all the results of various investigations and also the prakriti of the patient. So depending on that, we need to decide and finalize which type of Panchakarma procedure is to be done for what type of patient. Like for instance, as we see that sometimes the AMH levels are disturbed, hormonal imbalance is one of the causes. All the investigations come up to be normal sometimes, and still the patient is unable to conceive. And we see that there is a huge amount of stress which the patient and the couple is going through. So we have to plan the Panchakarma protocol in the form of Yoga Bastikram, Sneha Svedottar Yoga Bastikram, followed by Nasya Karma and such type of therapy. Sometimes when we see that there is some tubal blockage or some endometrium is not very receptive, or there is hypoplasia or hyperplasia, in that case, we can plan Uttar Basti, which again has to be followed by the Yoga Bastikram. We cannot give Uttar Basti directly. Firstly, we have to go for a Yoga Basti and then we need to plan for Uttar Basti. So Basti also depends on patient to patient, depends on the prakriti of the patient. So sometimes there is male factor which is responsible. For in that case also, we need to plan whether Shukra Janan is required or Shukra Shodhan is required. So depending on the patient, the condition and the duration, we can plan the therapy of the patient. And also the medicinal protocol has to be decided on the similar guidelines. So obviously, Madam has covered up all the points rightly. And congratulations to her and congratulations to all the organizers and a huge thanks to all the participants who have joined for this session. And thank you very much.
Thanks, ma'am. I request today's co-chairperson, Mrs. Madhavi ma'am, to conduct the question answer session.
Thank you, ma'am. Thank you very much. Madam covered all very thoroughly and very detailed, but there are some questions are there. So first, I will like to ask which oil for Nasya, and will you explain Nasya schedule, ma'am? Pushkala, ma'am.
Yeah. Ma'am, Nasya, what I generally give, I start, if the patient is a known case, we are treating them, then generally first cycle I don't give, I ask them to go for scanning, just to understand what is the condition, whether she needs only ovulation or as well as maybe the endometrium is thin. So we need to give medicine for that. That to understand, generally on the first cycle, first when the patient comes, I ask them to go for a follicular study. So during follicular study, if we see that endometrium is good enough, only ovulation is the issue, then I go for Nasya then. Or else in a regular cycle, I go for Nasya from 6th day of period or 1 day after the bleeding stops. For example, the bleeding stops on 4th day, 5th day I don't give Nasya, 6th day only I give. So 1 day we leave because that will also lead to Rukshata of Yoni. So, as told by Kashmir Samhita. So 1 day we leave, and from that day till ovulation, I ask them to go for scan. So what happens if the patient is unable to go for scanning, follicular study? I ask them to check the mucus discharge to check ovulation. Or I ask them as a randomly at least till 15-16 days to take. Okay, and then stop it. This is what I generally advise. If the patient is going for scanning, yes, we see that sometimes if the follicle is very well grown, how they give HCG injection like that. Evening also, I ask them to take 2 drops of Nasya, one dose in the evening also, so that next day they generally ovulate. Apart from this, I also ask them to eat til laddu and raw papaya as a vegetable, I ask them to include in the food. So if this is in some cases, if this is not enough, I either give them Chitragadivati or MD4 capsule, 2 capsules, only 1 dose, not for all the days. Like that also we give and stimulate.
Thank you, ma'am.
As Pratimarshanasya, 2 drops in each nostril.
Can we use capsule Falgrut for PCOD in any condition, ma'am? And if yes, then those.
Ma'am, generally, if you are correcting ovulation, you can start with that, after your ovulation, you can start with Falagrita. But generally, in many cases, we see that, endometrium is good enough, then we go for Falagrita. If endometrium is not good, then we go for Shatavaryavigrita. So if in some cases where we find that very much Vata nature is there, she's very thin, in those cases, I also go for Falakalyana grip. So like that we can go, or capsules also we can take.
How much Tungsten we have to add in Archayog, ma'am?
Ma'am, it is no direct reference is there. So what I do, when I prepare that ball, I put it over a plate of Tankad Basma. I just roll it because it's pretty sticky. So to roll it, I'll use it.
Yeah.
So that's how I use it. There is no quantity as such.
Okay. And when to add jaggery in Arka Pushpa?
Once you fry it,
Yeah.
and weigh the Arka Pushpa, one turn in mixie you can put, so that it's much more easier for you, or else it will stay as Pushpa itself. So a little bit of, you can grind it a bit. It's easier because it does not have moisture content. It's already fried. So one round in mixie, it will be kind of half powder. Kacha pacha powder will be there. In that condition, I add jaggery.
And you told about that obese PCOD, but how to treat lean PCOD?
Yes, lean PCOD, we generally go for Vata-Pitta Chikara Chikitsa. We go for more of Pushtikara Chikitsa. There, the kapha we are not seeing much. Only the Adya Rasadhatu, if you are correcting the Pradushtantava, the development is seen. Okay. So that is how we, in some cases where there is still in PCOS, as well as we see there is a stubborn PCOS, especially in lean PCOS conditions, we go for Vatahara Chikitsa mainly, because Anarthama again is considered as a Ashiti Vata Vyadhi, right? One of the Ashiti Vyadhi. So in that condition, it is a Vasti Sadhya Vyadhi only, it's mentioned. Vasti works a lot. We go for air and the Pooladi, Viruha Vasti. And even in that condition, we go for little bit of Shatakmadi and mix of Kshirabala Taila as a Anuvasana Vasti. So in these cases, we are mainly targeting the Vata in lean PCOS cases. Okay. Even in cases of low, high AMH also, if you see, so many cases, if you are stimulating rasa and for proper formation of rasa, you are seeing very good quality of ovulation. Right? So we are treating basically Vatahara Chikitsa here.
Okay. Ma'am, can we use Matra Basti in lean PCOD?
We can use Matra Basti in PCOD, depending on case to case.
Okay. How long we can use Chandra Prabhavati in obese PCOD?
Chandra Prabhavati, it is a rasayana we can use for any long duration of time. It's a rasayana.
Yeah. For ovulation, which Ayurvedic drug we can use to rupture?
Ma'am, as I told, if you are looking at internal medication, Nasya is very good. If you are not able to give the patient Nasya, she is not near you, you are not able to explain. In those conditions, if you want to give internal medicine, any Ushna Tikshna Aushadha will do. If follicular growth is there and only for rupture you are looking at, any Ushna Tikshna Aushadha. We have a classical reference of Trikatu Naga Kesara in Chakradatta. So in street also I have added Trikatu Naga Kesara as part of the medicine. So I do give MD4 and 3 years, Srita. You can also use that, or you can give Chitrakadivati. You can give Agnitundivati. You can give one doctor I know, Dr. Shakuntala Patil, madam. She is a good practitioner here in Bangalore. She gives this as an ovulation drug. Two tablets thrice a day she gives to take just 2 days before ovulation. So many patients come and ask her, ovulation dawa dena karke. So she gives that. You can give Gomutra Haritiki also. Any, I have seen any medicine that you use for Amavata also works well in PCOS.
Okay. Which Nasya we should use for ovulation and that time?
Ma'am?
Which nasya we should use for ovulation?
I use MD4 Thaila. I have tried many oils, madam. I have tried Kshiramala. I have tried plain Tila Thaila also. I have found pretty good result with MD4. MD4 Thaila is my proprietary medicine where we have prepared it from Tila Thaila, Gorakumundi and Dhanyaka. So Yamundi, you know, it stimulates ovulation. So we use that.
And what is the exact time, ma'am, when we have to give?
I give it once a day, morning, around, I ask them to take it. Pratimarshanasya, they can do it at home. So I ask them to take it in the morning. If she is 1-2 days before ovulation, I ask them to take twice a day just for stimulation.
Okay. Can we use Eranda Sneha for ovulation?
I have not used, so I cannot comment.
To increase endometrial thickness, what can we use?
Ma'am, endometrial thickness, I generally go for if the patient is having ovulation and endometrium is thin, then I go for Shatavariyadigrita. If the patient is not ovulating at all, if she is having maybe amenorrhea, in those conditions, I go for Pippaliyadigrita. So lean PCOS cases, you can go for Dadimadigrita.
Which oil in Yoga Basti, ma'am?
Oil Yoga Vasti, as I mentioned you, we can go for any Ushna Dikshna Ushada if the patient is a bit obese. You can go for Shatapushpa Thaila and Triphala Thaila mix. I go for MD4 Thaila because for almost 14 years I have been using this. I have got always given a promising result.
Which oil for ovulation? I think just now you
You
told.
can repeat it.
Yeah. That also you told that Nasya should be given for daily like Pratimarsha Nasya. Right?
Yes.
What is the Uttar Basti schedule in PCOD?
Uttarvasti, I see, when I learned, this is how I learned, because I may differ with many practitioners. We start from 6th day of period. I give every day for, maybe until 11th day or 12th day. If the mucus plug is formed, then we stop at 10th day also. So it depends on case to case. So many cases we have stopped at 10th day. Many cases we have done till 12th day also. Starting again when the bleeding stops, till that time I give.
Ma'am, diet plan for PCOD?
Diet is something which is pretty huge topic in itself.
In short, ma'am.
Generally anything which is Kapahara is very, very important. So it is very easy to say Kapahara. So when the patient comes, you have to advise cheese is something which is a very big no, because it is Tamasika Ahara in itself. It's a Malina Ahara, you make it raw, fungus has to come, and then you are using it, making it aged. You need to educate the patient, right? Many doctors, we are not spending time in diet. We consult the patient, we write the prescription. Diet becomes an integral part. So when I consult, I generally ask the patient to write a list. What all you eat, you have to give the list. So even on online consultation, I take the list. I see both husband and wife. From there, I start correcting. Before even I start the medicine, I can't correct their diet and lifestyle. So once you do that, even before medicine, they have a positive effect on the body. So what I tell, I ask them to avoid cheese, paneer. I ask them to avoid. Especially for the female, I'm telling. If she is having, if we are talking only about PCOS, then I ask them to generally avoid tomato. Also, cystic growth will generally increase with that. I ask her to go for physical exercise, not much pushtikara ahara if she is obese patient. I ask them to avoid generally dry fruits. Nowadays people have a craze of over nutrition, so they soak badam and all. No, everything is, though it is vatakara, it is also kapakara, it is pushtikara. So anything which is over pushtikara, we have to avoid. So that I educate, and then I ask them to avoid curd and deep fried items. Totally a big no to all bakery items. So coming to what you can take, I generally ask them to go for multi-grain dosa. I don't talk about not the sirudanya, what we say, right? So I don't ask them normal dosa without urad dal. So that I tell. Just 1 month before or 2 months before conception, I ask them to start with urad dal. As a part of preconception care, we tell them to take urad dal. Or else, this is what I tell, I'd ask her to include lots of lashuna and dill seeds. I generally give them as tea. So that and all, we have something called PCOS tea. When patient comes, we just give some packets so that they put it in hot water and drink it. Not bitter, but as a medicine, it goes inside as a water. How we advise Gokshura Pana. Like as water, when this goes as a daily routine, it goes. When it goes, the result is good. So I add Shatapushpa, a little bit of that is the dill seeds. I add the fennel seeds, which is again Shatakwa, and then I add little Trikatu or plain maricha in that. I ask them to take with little haldi powder and take. So they also feel so refreshed because the smell is pretty good with dill seeds and all. So they feel refreshed as a morning tea. So they are avoiding milk. If it is in excess, then I ask them to take this.
Is dermal cyst will be treated completely?
I have 5 to 6 dermoid cysts, all went for surgery only because we don't get much result. My experience, no result in dermoid cyst.
Ma'am, steroid tablets are there, no? That schedule in PCOD for how many days?
I generally either give for 2-3 months regularly, or I give only till ovulation if they are planning conception. That's it.
Is submucosal fibroid can be treated?
Yes, ma'am. We treat, that's only fibroid which has an immediate result. No, we treat it well.
What?
Because I
what will be
generally go
given, ma'am?
for Uttarvasti because my professor advised not to give Uttarvasti in Charatela. It was her very bad experience with that. So from that day, we have never used in submucous fibroid Charatela. We were giving, before I made this MD4 Taila, we were giving with Triphala Taila, add a little Kshara into it and give. Or nowadays I'm using MD4 Taila. For added benefit, if she is not looking for pregnancy, I add little Tankana and push the Uttarvasti Taila, or else only this is good. Internally also, we go for Vaikranta Basma or we go for Shataputi Abraka Basma for a Lekana effect.
Ma'am, in unmarried girl, endometriosis, how to treat?
Nowadays, it's a challenge because Pichu, it's much more easier to treat in married girl. Unmarried girls, if you see a few years back, we were not getting such cases. Endometriosis was supposed to be only in the women after marriage we were seeing. Now small girls, you see, unmarried girl.
Yeah.
I'm just talking about a girl who is only 12 years old. She is having endometriotic sac, so big. And when she came to me, already she had done one surgery and she has come. Once already it was removed. So such cases we are getting, it is increasing a lot. Definitely lifestyle management is very important. You have to educate about food, because unless until there is, what we say, food which is increasing the inflammatory change in the body, like fried foods and all, definitely such cases will not come. So we have to concentrate on the diet. Coming to internal medication, if the patient is tolerant, a little obese, then we can go for Guglu Tiktakam Kashayam or else plain Tiktakam Kashayam. So the Guglu Tiktaka has a very good result in such cases. I also go for a combination with Vaikranta Basma and if possible, Vata Churna. Vata Churna we use. So we also can go for this from Hyderabad. Dr. Surendra Sharma sir has given this formula where he told us to use equal amount of tila, Krishna tila, sugar and lotus seed. Krishna tila, sugar, lotus seed, 3 medicines, equal part. This you can give, that will become kind of powder. You just have to ask them to eat 1 teaspoon twice a day. So this also controls the bleeding, Krishna tila, but still it controls the bleeding and beautifully works on endometriotic system. That you can use. And one more thing I wanted to add, because I was telling about food, I remembered. When you asked about food, I advised before pregnancy in PCOS, I asked them to take fulka makana and shingada also. Water chestnut and foxnut. That I ask them to include regularly in food. That improves fertility a lot. In most of the cases, we have found very good result.
Ma'am, what is the treatment for hirsutism?
No, as I've told you, I have tried many applications also, Brahmashatana and all many, because if you see my house, one whole shelf is full of books. I am crazy on reading. So I read many books. If you see Vangasena, I go deep dive into Basavarajiyam, check formula from there. Many books I check. So many I have tried also. Not much of a result. It will go, but it will come. So one of my student in SDM had a UG RGHS research grant for one Roma Shatana. But on hands and legs, it was pretty good. But I don't know on his.
If thin endometrium is there with dominant follicle, what should be given?
Shatavari Adhikrita.
Ma'am, Shatavari Group and all your products, is Shatavari Group available over there?
Shatavari Adhikrita is available everywhere. Srivita, if you are talking, you can, I have given my number, or you can get it from Dr. Pradnya ma'am also.
Yeah.
Srivita, MD4, because I don't, doctors only I give. I don't give to medical shops and all. So it's always better like that, because we know how to use. They just, it's not from the shelf. You take it and use it. Because Srivita, if you use it in menorrhagia, bleeding will increase. So we will know better. They can't just sell it off like that. So I don't supply to medical shops. We give to doctors directly. So I do supply whatever. If you ask one piece also, I'll send in courier.
Ma'am, which drug are used in acanthosis nergaris?
Ma'am, lots of formula are pretty good. You can go for a basic scrub in that area. Internally, go for Rakta Shodhaka like Tiktakam Kashayam. I give for Mahamanjishtari Kashaya also. Okay, generally with pimples and all, people come. I have one more case. I'll show you. One pic I'll show you. Full of pimples. Only Mahamanjishtari Kashaya Srita I have given. It's totally gone. So that, because they go for the skin doctors, they don't come to us. It is basically a hormonal correction. So that we give. And coming to acanthosis nigricans, after a basic scrub is done, I go for application of Manjishta, Spatika Basma. I do add a little Tankan Basma also, and ask them to rub over it with a little lemon juice, apply and rub over it. That will go. And as a thin paste, I give Multani Mitti and all this Varnia Ushnas I put and ask them to take a pack.
Okay.
We give packs like that to patients.
In ovulatory cycle, what primary should be given for menses?
That's what we tell. No, if there is a amenorrhea, we have to check. Generally, when the patient comes, immediately you cannot send for a scan. If possible, if you are a senior practitioner, generally, if you write a scan, also they don't mind. But when you are starting your practice and you write scan everywhere, they'll tell you are writing for commission, right? So many doctors, ask me, you are writing, they will take. If I write, they will not take my answer. So when you give a Tikshna Ushna and she's not getting cycle, that's when you can ask her to go for scanning. If the endometrium is more than 7 mm, any of these will work. Like even Drona Pushpi leaf also will work. If the endometrium is thin, then go for Grithapana.
After copper T insertion, no period in hypothyroidism and obese patient, what is the treatment?
Copper T, if a patient comes, I'll tell her only to remove first, then only I'll treat. I will not treat her. So many cases with spotting, so many cases with heavy menstrual bleeding, so many cases with foul vaginal discharge. The moment it is removed, it is relieved. I tell an example of one Ayurvedic doctor. She was working in a college. So this madam called me. I said, ma'am, get it removed. She was like, no, we need space. I said, first you remove and see the result. If you want, you again go and insert. But just remove it and see. Third day, all the symptoms are relieved. So we need to educate this one.
Okay. Ma'am, which oil for Uttar Basti in endometriosis?
Endometriosis, if it is active, if there is so much of pain, you are seeing that the cyst is pretty big, immediately I will not suggest to go for Uttaravasti. Go for Tikta Pachaka, then only next cycle you can go for Uttaravasti. In Uttaravasti, Mundi, if you read Gorak Mundi, you will see that there is a Yoni Shulahara effect is there. So there are cases where the moment you keep MD4 Tyler Pichu itself, not even Uttaravasti, pain is relieved. The patient. So I had a case of 4th degree endometriosis, which is called as frozen pelvis. She came with taking 3 or 4 painkillers per day. Now the patient is totally active. Okay, totally normal lifestyle, because quality of life, QOI is very, very, very important, right? So in those cases, I do give Pichu throughout the month. Rather than Uttaravasti, Pichu works a lot in those cases, because you are giving a long-standing medicine application, right? That works a lot in endometriosis rather than Uttaravasti. I do use MD4 Thaila, had a very good result. Many of my friends, doctors, they use your medicine. The moment you keep Pichu, it works like a miracle because that pain relief is there immediately. Whether endometriosis is coming down or not is the next question. Pain relief must you give. So the patient is very happy and they are ready to take the medicine for a little bit duration of time when you are treating. So next, I generally go for Vasti. The moment you give a Lekar Vasti, it shrinks. That gives. So once we start this step-by-step management, the results are pretty good.
Ma'am, if endometrium thin with low AMH, which type of treatment we have to follow?
Ma'am, AMH, what I feel is can be taken as two, right? Well, if low AMH is there, sometimes what is AMH generally? Generally, many doctors say, oh, we cannot increase AMH because it's not number of follicles. It's a wrong notion. AMH is released when the follicles are taken for, recruited, basically. So that is when the antral follicles release this AMH, right? So maybe the ovary is so stubborn that it is not getting released. That's why AMH is low. Or maybe it is Vata Pradhana and getting into a early aging process. So that you have to see. If your FSH is more, then you have to think that it is a Vata Pradhana Vyadhi and FSH is more and AMH is less. It is Vata Pradhana. Go for Rasayana Chikitsa because you are reviving it. So if you are seeing that FSH is normal but still AMH is low, then you have to go for Vataka Sahara Chikitsa. Like Lekana and all will work. Stimulation will work. So,
Thanks. Madam, treatment for hydrosalpinx.
Hydrosalpinx, see, you can give basic anti-inflammatory medicines like Gandhaka Rasayana or, I generally go for Kajali preparations with different drugs I give. So internally, if you see, you cannot go for Uttaravasti. Okay. So this is something which I have found useful in my practice. There is no direct reference and all for this. I do a tight vaginal packing with Jatyadi Grita or Jatyadi Thaila. Tight vaginal packing. So you count a number of this one you are keeping and then you soak it, okay, in this, and then you just push it into the vagina. Then you count how many strips you are keeping, count it properly, push it, ask them to rest there for 2 hours and remove it. This, I don't know. I first tried because I committed that I will be doing Yoni Varti for the patient. Incidentally, I could not prepare Yoni Varti that month. I didn't want to stop the treatment because the patient was already very much stressed. So this was happening in SDM. So treatment, they already come. So I didn't want to just stop. I said, okay, lie down, I'll do. I just gave a tight vaginal packing. That case, we got result. Very next cycle, there was total normal scanning. Then based on this, we tried on 2-3 cases, who are not so fussy patients. We started trying, got pretty good result. Now that is the line of treatment that I give for the hydrocell.
Ma'am, treatment for patient with primary infertility, SHG shows uterine adhesion, that regular menses is there.
Why uterine adhesions are there? Maybe there's an infection that you have to rule out. If there is any, TB, endometrial TB, maybe there. So you have to rule out that. Unless until that is done, we cannot suggest it.
Thank you, madam. Thank you very much.
Thank you.
Answers. Pradna, ma'am? All is.
Yes, thank you, ma'am.
Covered all.
Thank you very much, ma'am.
Thank you very much.
Thank you. Thank you.
Dr. Smita, madam, please continue onwards. Our
Thanks,
last.
ma'am.
Thanks.
Thanks, Pushkala ma'am, for giving such a informative lecture. PCOD and obesity are increasing day by day due to lifestyle changes. Today's session will be very useful for us for our daily practices. Thanks, Amrita ma'am, for adding tips for today's session. Thanks, Madhavi ma'am, for conducting the question answer session so smoothly. I also thanks Vima Women's Forum State Branch for organizing such a wonderful session. Thanks all dignitaries, NIMA and NIMA Women Forum Central and State Branch for attending this session. I also thank the technical team, Dr. Shilpa ma'am and the Dule team branch, and our technical support team, Dr. Girish Daga, Dr. Manish Jain, for making this session run so smoothly. Our next session is on 20th October. The topic is Vandyatva, Sthanik Chikitsa आणि Sarvadehik Vichar by our speaker, Vaidya Gauri Borkar. Okay. Pradnya ma'am, is it, can we,
Thank you, everyone.
Yes.
thank you ma'am.
Thank you, ma'am.
Thank you, ma'am.
Okay.
Splendid. Very good session.
Thank
Right from
Thank you,
speaker
you,
to
ma'am.
Thank you.
chairperson and anchor, everything was perfect. Thank you.
Thank you, Pradnya ma'am. So we close.
Thank you, Pushkala ma'am. Thank you.
Thank you, ma'am.
Thank you, Pushkala ma'am. You have given
Thank you.
a vast list of drugs. Many were not known to us. Your
Thank you.
and that banana leaf juice, that was very new.
Banana flower juice.
Flower juice.
Banana flower.
Yes.
Banana flower is very
Sorry.
good.
Thank you. Thank
It
you.
was new. It was new.
Thank you.
Being South
Very
Indian,
informative, and it was some different treatments really you have
Yeah.
told us. Thank you very much.
Thank you very much, ma'am. It's a pleasure to talk in NIMA. It's like I was so happy when Pradnya ma'am called me to tell this. I was actually 1 month back, we had a sad demise of my father-in-law. I didn't know whether I could actually prepare and come also. So, but it was a
we
very
will welcome you again, ma'am. We will need you again.
Yes, ma'am. Yes. We think it's a very
All
good.
are very much interested in buying your
Yes.
medicines also. So
Yes,
we will
ma'am.
contact
thank you.
you
That
by-
would be a great support because
Actually,
it was a
I am
dream project for me.
using Sri Hita since last 1 year, and
Okay.
excellent results.
Thank you.
Okay. It's very good, very good. Thank you, madam. Thank you.
Thank you, ma'am. Thank you all. I'll leave the session. Thank you.
Thank you.
Chalo, okay, bye. Thank you, everyone.
Who will end?
Thank you.
Co-chairperson, anchor, सगळ्यांना thank you. It was a
मीनाक्षी मॅम एंड करा.
हा. अच्छा.
एंडचं बटन येतं.
हा, ते आलंच नाही, मी ते शोधते.
वरच्या साईडला असेल.
तुम्हाला होस्ट बनवू का नाही? मला
मला मी करते.
होस्ट बनवू.